Today's injection will be an intramuscular injection. My patient Mary Smith will be getting Vistaril for her moderate anxiety. I will go in and check with my patient to see what her anxiety level is. She is got several different choices for her Vistaril if she's mild to severe. Patient is Mary Smith. I will prepare her medications outside the room. I will perform hand hygiene. I will read the MAR, make sure that it is Mary Smith. Check her med drawer, look for her Vistaril, which she has right here. The patient has expressed that she has moderate anxiety, so we will be giving her 50 milligrams of Vistaril. I will then alcohol the top. I'm going to use a 3 milliliter syringe and a 23 gauge needle. I will twist this on like so. So this is a 50 milligram per 1 milliliter bottle of a dose. So I will be using 1 milliliter to administer for her. So I take the cap off. I pull this back to 1. So 1 milliliter of air. I will then insert this into the bottle. Oops, put the air in first. Turn this upside down and pull down to get 1 milliliter. I will go a little bit past the 1. Pull this off. Tap it. Get all the air bubbles out. And then I will move this back up by twisting slowly to the 1. This will make sure that all the air is out and that the needle is full of medications. Okay. I will then put the cap back on using the scoop method. Put this down, and I will prepare to take the medications into the patient's room. I will knock on the door. Mrs. Smith, I'm here with your medication. I will check the MAR versus the patient's armband. Will you spell your last name for me? And what is your birthday? Okay, thank you. I will check the MR number compared to her bracelet as well as the spelling and her birthday. You'll be getting 50 milligrams for your moderate anxiety of Vistaril. So I've checked the right dose, I've checked the right patient, the right time, the right amount, medication, and patient. There's a lot. So again, I will perform hand hygiene. I will put my gloves on. I'm going to inject this into the deltoid muscle, the deltoid site, and in doing so, I will look for the acromion process. I will put 2 fingers down, mark my site. I will look for the deltoid muscle by creating a triangle that's upside down. In the middle of that triangle, I will swab. We will be using I would swab using an outer motion and circle. For this, because it is, I will be using the Z-Track method. So I will get my injection, take the cap off, come up, point, oops, and I will insert. Pull that out, and then I would release. Again, I will take my needle using the scoop method, put this back on, and then throw that into my sharps container. So the other options I had for administering this medication would be to use the vastus lateralis site, which would be on the thigh, where I would divide the thigh into 9 sections. I would use the vastus lateralis down here in the middle of the outer section. I would also Z-track and inject there. The last site I could use would be the ventrogluteal site, which on my patient would be, I would have her turn on her side. I would find the greater trochanter of the femur. I would use my index finger to find the anterior superior iliac spine, and then I would use my middle finger and point it up toward the iliac crest. And in that V is where I would swab with my alcohol. I could leave the alcohol swab right there to mark my site. I would Z-track, getting my hands out of the way, and then I would inject the medication right there. I would not massage nor do anything with that. I would put a Band-Aid if necessary, put my patient back on her, whatever her comfortable position is, cover her back up, put the side rails back up, raise her head into a comfortable position, ask if she needs anything, and then I would leave the room.